Hi guys, my name is Girish, your host for today for Back to Basics. Today we're gonna talk to you. It's a little serious topic. Yes, I understand with all the topics that we've done so far, but it is a true topic. It is a known topic. It is some topic that you don't want to touch about and talk about, but we're gonna do that today. We're gonna talk about that today in Back to Basics, and we're going to go into the detail of that topic. So the topic is about talking about elderlies and taking care of elderlies. We gotta respect those elderlies, and we go step by step on that. And we'll talk to a doctor, a friend, I should say, because I've talked to her many times now, and it seems like I've known her for years, but it's actually a couple of weeks. So use Dr. Julie Davelman to the show and Back to Basics. How are you doing today? And thank you for coming on the show.
Doing great. Thank you for having me.
Yeah, absolutely. Thank you. So the first thing is, before we get into the basics of the topic today, what is Back to Basics means to you?
So, back to basics to me is beginning to think about how we think about things, right? And as a psychologist, figuring out how people come to think the way they do is a large portion of the work.
Mm-hmm.
So, back to basics to me is let's look at our assumptions, let's look at how we come to believe what we believe and talk about it, right? So we're all on the same page.
Yeah, absolutely. And thank you for coming on the show. And I am kind of honored that you are on my show and helping us out with certain questions that people they have. Uh, so can I call you Julie, or should I call you Dr.
Absolutely.
Julie? Okay, so Julie,
Really
so
fine.
so let me ask you this: How is it really a tough topic to talk about, or is it a like a taboo, or what do you think of how
So
people react to this topic?
So I think that it's a topic that doesn't get talked about enough because lots of people are facing the need to take care of elderly parents or elderly loved ones. And as many resources as we have available for caretakers of children,
Mm-hmm.
we don't really talk about the needs of those taking care of the elderly.
Mm-hmm.
We also don't often talk about the needs of the elderly,
Mm-hmm.
but even more so of those who are taking care of it. So part of that is because often these conversations aren't pretty. And part of it is because we would like to believe that this all kind of happens naturally and without effort. But that is unfortunately very far from the truth.
So it is a taboo topic to not talk about, I guess. Is that the
I
right?
don't know if it's taboo as it's just a difficult one that people would prefer to avoid if possible. So when you ask people who are taking care of somebody how they're doing, they'll frequently respond with how their loved one is doing.
Yeah.
So if I was taking care of my parents and you asked me how I was doing, I would say, well, my mother had a really good day today. She was able to walk, around the block and she doesn't usually do that. And
Yeah.
it takes some effort to get people to actually answer, no, no, I was actually asking how you're doing, not how the person you're taking care of is doing. But they're so linked that in some ways people have trouble answering these questions and talking about themselves in this context.
Now, Julie. So sometimes what happens is when we try to help out an elderly, then they say, you know what, you're not going to be there every day. So why should you help me today? Does that make sense? Like for
Yep.
example, if I'm helping a an elderly cross the road, the elderly says, "Don't help me because I'm not you're not going to be there
Hmm.
tomorrow." So is that a I don't know, is that a teaching that we need to teach each other to care and one another, or should we just leave them alone?
Well, I think it's actually a much more complicated question than it seems on the surface
Okay.
because there is this tendency to undermine people. And just because they're elderly doesn't necessarily mean they're either infirmed or impaired.
Yeah.
And because holding on to their independence and holding on to their mobility is often the most important thing to them, sometimes offering unsolicited help is actually harmful, right?
Mm-hmm.
So, for example, if you're at, I don't know, the supermarket and you offer to carry groceries, that, on your side, it's being done out of the kindness of your heart, But on the other hand, if that's the last thing that, holding on to that card and getting their groceries to their car is the last thing they're able to do independently, it's really hard for them to give that up. And it just highlights for them that society sees them as people who can't.
So, Julie,
Uh,
a couple of weeks back, sorry to interrupt, but I saw an article, or I should say a picture, and I want to show you that picture of how people they react to this.
mhm.
If you look at that, the parents are holding hands to the kid, and then the other picture is that the kid, when he gets older, is holding hands to the elderly.
Mhm.
Now, there's no words on the in the picture, but it says so much. So, do you think it's just a picture, or do you think it's people are actually acting to this?
I think that there's a lot of people who have very beautiful relationships with their elderly parents
Mm-hmm.
and who go above and beyond, even though they don't think so. They think they're never doing enough.
Yeah.
Who do a lot of caretaking. It's really about recognizing what does it mean to be a caretaker and what it means to be within the realm of your competence and within the realm of what you can sustainably provide.
Yeah.
So, for example, if you have a parent who has Alzheimer's and they get disoriented and they would walk out of your house and go wandering around, you would absolutely love to take care of that parent 24/7.
Mm-hmm.
But can you really not sleep forever so
Mm-hmm.
that you can watch that door and make sure they never leave? You
Yeah.
probably can't,
Yeah.
right? So it's also recognizing your limitations, developing appropriate resources, and then being okay with yourself for needing those resources.
Do you think we should talk about the elderlies after the age of 18 when you're an adult and we're getting into college, or do we talk about when you're earning the first paycheck and then you start thinking about it? Is there a right time?
You mean in terms of when you begin to care for when the relationship kind of reverses and you start to take care of your
Correct.
parents?
Yes.
I think it's so family specific, right? And it often has to do with the parent's ability to be independent.
Mm-hmm.
While the parent is primarily independent, they want their independence and they don't really want you necessarily as anything more than a loving child and a companion,
Yeah.
right? So they
Yeah.
love to see you for the holidays, but they don't need you to be doing the dishes,
Yeah.
right?
Yeah.
When they get to the point where independence becomes an issue or there's things that they're no longer able to do, then it becomes a different issue because now the adult child needs to put things into place that the parent may be resisting
Mm-hmm.
or the parent may not know to do or the parent may really fight doing. So think about it like when the adult child has come to the realization with advice of doctors that the parent can't drive anymore.
Do you think, because you brought up a good point, you're saying family oriented, so which means culture? Does that mean different cultures have different thought process of caring elderlies?
I think many different cultures have different impressions of how what is appropriate and what isn't appropriate, and in some ways, that often conflicts with having the resources. So,
Mm-hmm.
in the example that I gave with the Alzheimer's patient, for cultures where taking care of your own is treasured and expected, that decision for that adult child becomes even harder than in a culture where it's okay to have your parent living elsewhere or having your parent taking care of somebody else.
Mm.
In some ways, it's similar to the discussion of, can a child go to daycare or do they need to be taken care of by a parent or a grandparent,
Mm-hmm.
except with much more dire implications, right? The adult child may not neither be equipped nor can do it safely.
Mm-hmm.
And it becomes very difficult for them to make that decision because, in addition to their own personal guilt, they'll also get the societal, cultural pushback of how could you?
Mm. So let's say if I put my parents into a home care, okay,
Mhm.
um, does that mean that they're going to be less sensitive to the feelings of the patient versus a family?
So the answer to that, unfortunately, again, is depends.
Mm-hmm.
So good care is good care.
Mm.
And you would most likely, if you were to place your parents somewhere in a facility most likely you would take on the role of their advocate and their kind of monitor that everything is going according to plan rather than hands-on caregiver, right?
Mm-hmm.
So you're probably not going to be the one helping them shower, but
Mm-hmm.
you're going to be the one who makes sure that they got a shower every day.
Yeah. Yeah.
And that is a no less important role, and you may not be able to do both. Again, unfortunately, within elderly care, there are so many variations of things that within a regular home and without specialized training, somebody can't provide.
Yeah. I mean, it does get expensive also because now we got to talk about expenses too. We got to talk about medical. We got to talk about, I guess, hoteling when they're staying there, and everything else, even the doctor treatments. So it does get expensive in those angles, and I think people they get afraid and frightened to get into that position. So I think home care is meaning staying at home, I mean, and with family, I mean, not home care in the facility, but
Hmm.
um, I don't know. It seems it's a really tough question. It all depends on everyone's financial needs and
And it depends on level of care,
level of care, right?
right? So somebody who is relatively independent but just needs to have, let's say, their groceries brought in and they can't clean anymore and they need a little bit of help with their bills is a very different kind of person or in a very different state than somebody who's bedbound and cannot get out of bed and needs to be lifted using specialized equipment.
So, do you think helping out the elderly with financial is considered help or is considered what do you call that? I'm not really sure.
Again, it's so family specific. Lots of families have planned for this and have, insurance policies or long-term care policies
Mm-hmm.
that take care of this or have accounted for it in some other ways. And there's families who haven't.
Mm.
But that becomes one more of those difficult conversations that are better off had earlier rather than later,
Mm-hmm.
right? Because that's not a conversation you want to be having with your 90-year-old parents. That's a
Yeah.
conversation you want to be having with your 50-year-old parents,
Yeah.
right? Because if a plan needs to be put into place, that's the time to put it into place, not on an emergency level when now it's, dire.
So, Julie, so do you think it's a different thought process as of today as compared to olden times? I'll explain what I'm trying to say here. In olden times, we are obliged to take care of our parents. Okay. Today, nowadays, millennial they think that you know what they can take care of their own, or I can take care of my own. I mean, my kids are not going to go and take care of me,
Mhm.
hypothetically. So, do you think I should plan my own destiny to the home care, or how do you think?
I think that these need to be family discussions, right? What the main difference between now and even 100 years ago
Mm-hmm.
is the fact that people are living longer,
Yes.
right? So when you're talking about somebody who's potentially impaired, they may be impaired for 10, 15 years,
Yes.
right?
Yes.
And that's a very different caretaking scenario than a scenario of a year or covering, kind of in an emergency situation or getting them back on their feet and getting them back, to their own home.
Mm-hmm.
Somebody who has, let's say, Alzheimer's and is disoriented and has impairment can be that way for many, many, many years.
Yeah.
And it would be, and you've talked about kind of the financial implications of placing them. There's also financial implication of lost income for the kids who can't work
Mm-hmm.
or for ones who have, can't have peace of mind because they're constantly worried about what is their parent doing while they're sitting recording a podcast,
That's right.
right?
That's right.
Um, so, and then on the flip side, there's what's called the sandwich generation, which is the people taking care of their parents while they're still taking care of young children of their own. And burnout is a real thing. And at that point, you end up not really a good child or parent,
Mm.
right? Because there's only so much of you to go around. So part of this is really being honest with yourself and with your family about how much can you take on and not feel like your resources are infinite.
So you're saying this is a healthy discussion to talk about with your
Absolutely.
youngsters and plan out that way and I guess save money at the same time or maybe plan out what health plans do we need later on.
Hmm.
Because I think I don't know the details and I will find out when I get to that stage, I guess. But the Medicare and AARP, I don't think it's much of coverage on that. I'm not really sure for elderlies, or are
I
they?
actually know nothing about the advantage of being a psychologist is that you don't also have to be a financial planner.
Yeah,
So,
yeah,
but I would certainly, if I'm working with a family who is considering these different options, or we're talking about aging and they want to age in place, which is, in their own home,
yeah,
I would certainly recommend they speak to somebody who specializes in this and can provide them with a plan because financial considerations are a consideration in everything we do,
yeah.
right?
That's right.
Whether we like it or not. So, as our legal things, who do you want making decisions for you when you are no longer able to make decisions? What
Mm,
do you want those decisions to look like?
yeah,
You may be able to identify all those things ahead of time, or
yeah,
you may put that in the hands of a trusted, child or another loved one.
yeah.
But those things are always better done ahead of time than on an emergency basis as anything else.
Yeah, so guys, I want to explain here. So she brings up a good point. When you want to plan out financially, uh, obviously talk to your financial guidance and to see what type of plan do you need. Maybe you need to contribute maybe every week, every bi-weekly, just to get where you are and what your goals are going to be. Not for yourself, but even for your elderly, if that is your plan. If it is a plan just for you and your spouse, so be it. But we're talking about elderly caring, and we need to plan it out. We need to see the future because we don't know what's going to happen. It could be just like what she said. It could be long time care. It could be forever. I mean, it could be 10 to 15 years. And that's a long time, and that's a burden if you think about it from the financial point of view, from groceries point of view, and obviously emotional point of view. So, Julie, regarding emotional point of view, is it really stressful for the family of you know understanding that they're getting older and they're going to be dying soon, or they're coming to that border? Do you think uh that's a bigger topic for elderlies, or how does?
So let me make sure I understand you correctly.
Yeah.
Does taking care of an elderly put strain on the family,
Oh,
or are
that's a
you
better way
asking
of
about
saying
the
it.
elderly
Yes.
person
Yes.
themselves?
Strain.
So thus, because to answer the question you didn't ask quickly, different people approach their end of life issues differently, right? There
Mm-hmm.
is no cookie cutter way to answer that.
Mm-hmm.
However, there is a cookie cutter way to address whether it is put strain on the family to be taking care of anybody. Yes. Um, and there's a lot of things that are a straining. One is obviously time. It's one more thing you have to be committed to. The other thing is guilt,
Yeah.
right? No matter what you're doing, chances are you're feeling like you're not doing enough.
Yeah.
And there is no sense of enough, right? If you're going to visit them daily, well, why aren't you going to visit them twice a day?
Right.
Why aren't you spending, all the weekend with them? You're only stopping by for an hour,
Mm.
right? So there's always the sense of more. And sometimes, as a way of controlling their own anxiety, the elderly person may demand more, which just feeds that, right? And it's not that even that they're being so demanding, is that they're worried and anxious, and this is how they're controlling it.
So.
On the flip side, they may seek independence where independence wouldn't be appropriate, right? So,
Mhm.
as the example I used before with driving. So now you have to take on the driving role because they can't do that. And
Mhm.
you need to have the battle with them about taking away their car keys,
Yeah.
right? So all of those things become very straining. And unfortunately, and the scariest part often for family members to talk about is the only relief is death, right? Unlike raising a child, where eventually the child gets older and becomes more independent,
Mhm.
with every passing year, the parent is likely to get more and more impaired, need more and more help. And the only relief to be had is their death. And people have a very hard time kind of wishing for that.
Mm. Mm. So families, they usually have uh, several siblings versus just one. So let's give two examples here. So if you have several, brothers and sisters in the family taking care of the elderly, is there a such thing that the elder sibling will be helping out versus the young one, or just is there a certain rule like that? Because there's a
Unfortunately,
because there it seems like a lot of people come up with that their own saying that the young one is going to do it or the elder one is going to do it, or
So
yeah.
it, I've unfortunately seen it both ways.
Okay.
What I mean is not in terms of older or younger, but when they're siblings, sometimes they're great support to each other. They pitch in together and they're on the same page, and it makes this very difficult stage of life easier. I've also seen that the sibling conflict is by far the most stressful thing, where everybody thinks that what needs to be happening is different, where everybody's kind of stepping on each other's toes, and that creates a problem. And
Yeah.
the third scenario is where one sibling is involved. Often that's dictated by proximity, so the one who's physically closest to the parent, and the other sibling or siblings are not involved, and making that situation even worse, have a ton of opinions about how that sibling who's actually doing the work should be doing it.
Yeah.
So sometimes multiple siblings actually breeds conflict, and you certainly hope that doesn't happen. But again, the more honest conversations the family has had up to the point about what elderly care will look like, the easier the stage goes. As do legal papers, like who is responsible for the financials of the parents if they're not able to do it themselves.
Hmm.
Is it all siblings? Is it one particular sibling? Well, the parents should be the one deciding that and not just leaving that up to chance.
Mm-hmm. It is a tough topic, and it seems like there are. I've seen a lot of the word is rivalry between the siblings and the families, and that's how they get separated also at the same time.
Mhm.
So it's kind of shame that uh, just for an elderly. I mean, I'll be an elderly soon, and it'll be a shame that if there is a dispute between my kids to for us. um, so it is a tough topic, and so there's no right time to go and talk to the kids. I guess. I guess earlier the better. I guess is that
It's
correct?
it's often honestly it's often the kids talking to the parents, not the other way around. But
Oh,
yes, there is really no good time. It's really about, family planning like any other family planning, right?
yeah,
Like and just like you talk about kids going to college and then getting married and moving out on their own, then you talk about what's it's going to look like when you're no longer able to take care of yourself,
yeah.
right?
But Julie, you bring up a good point, but I don't think the kids will actually bring up that topic. I think it'll be more or the parents bringing up the topic to the kids. No.
Usually it's everybody waits too long, and then the parent has some sort of impairment, so they fall or they're unable to walk up the stairs in the home,
Yeah.
or there's a car accident,
Yes.
and then these conversations all of a sudden come to the forefront.
Yeah. Yeah. It.
So if an adult child, for example, as they're beginning their independent life and are family planning their own life, right, and financially planning their life,
Mhm.
if they say to their parents, hey, what do you have in place? Have you thought about these things? If you haven't, here's some resources. Talk to these people. Let's get a plan in place.
Mm.
Um, so
Yeah.
it's less important about who starts the conversation than the fact that the conversation happens and then the right things are in place and that everybody knows where they are, right?
Yeah.
So
Yeah. Yeah.
a will that nobody can find is not nearly as helpful as, you know, a living will that people can find.
Yeah. Yeah. So, Dr. Julie, thank you so much for this topic because it is a tough topic to talk about. Especially in these times, also in the pandemic times, because
Hmm.
that you're bringing one stress to another stress
Yep.
topic. It is very stressful with that. And I thank you for giving a little insight. You know what? I do have one more question. Is there a difference between the previous and during the pandemic time, the elderly questions, or is pretty much the same?
So it's been actually a really, really hard time for caregivers for a lot of reasons. A lot of facilities have been closed
Mm-hmm.
to visitors, so they have been unable to see their loved ones,
Mm,
sometimes for almost a year.
a year. Yeah.
They have most facilities have opened up under some restrictions, but that was very scary, especially if you were used to being an advocate and making sure that things were getting done the right way,
Mm-hmm.
and now all of a sudden you've lost that control and the ability to check.
Yeah.
Um, the elderly were also much higher risk.
Mm-hmm.
So for people who were taking care of stay-at-home parents who aged in place, they couldn't go visit. All the functions they would normally do for them, they could no longer take on. So it was unclear how those things were getting done.
Mm.
You couldn't check that that your parent were cleaning out the old food out of the refrigerator and not eating things that were 2 months old, right?
Yeah.
Like there was none of that checking.
None of that
And
checking, right?
then it was that final worry about what if they get sick and the implications of that. So I think that COVID has actually been a really hard time for caregivers in a lot of ways, and also resources that you might have been able to use in the past, like adult daycares or visiting nurses or things that used to happen to relieve some of the care
Yeah.
were also no longer happening, and
Yeah.
then you were 100% on you all the time.
Yeah. I mean, obviously I don't, I pray that nothing else will happen, but if there is a COVID 2.0 somewhere along the way, at least we're kind of prepared as to what needs to happen or what we should do when
Right.
it does happen similarly.
Yeah, it's about planning. Planning is your best antidote for things,
Yeah.
right?
Yeah.
So the more you can plan ahead, the easier things are when things happen. Unfortunately, with COVID, we didn't really know what to plan for, right?
Right.
So
Right.
um, that was part of the problem everyone was having, is the rules of the game kept changing, and we couldn't figure out what to do in response.
Yeah. Yeah. So, Dr. Julie, thank you so much for coming. So, one last thing. Any last words before you leave for from this show today?
I think it would be to all the caregivers out there about what an amazing job they're doing, and get yourself the support that you need. You don't need to be doing it alone. You don't need to think that just because you're tired or this isn't fun or this is not how you imagine spending your time, that you somehow love your parent any less. So get yourself the support and the help that you need so that you can really be the best for them and for your own family that you can be.
Thank you so much. So, guys, we spoke with Dr. Julie today, and we talked about the toughest topic that we can ever touch is, taking care of the elderlies. We talked about the financial side of it, kind of, and we gave you some guidance of where to go and what to do, and how to feel, because it's more emotion than anything else. And believe me, it is really tough because you don't know when you come to a certain stage of life, you want to take care of yourself or you want to take care of the elderlies. So it is a life balance type of thing that we need to take care of and think about. So there is a quote of the day I always come up with, and the quote of the day, let me see, and I want to wear my glasses if you don't mind, guys, because you know what, obviously we are coming to that age and time for that. The quote of the day is, we respect our elders. There is wisdom that comes from experience, and I am not going to stop learning from wise counsel. Now, just keep in mind, this quote, I do think that this is the right quote for the episode today. And believe me, talk to your parents, talk to the elderlies, talk to any elderly, and see how they feel and what they want. And that's how you learn. So guys, as always, everything goes back to basics, and that's what we did today, guys, on this episode. Take care, God bless, I'll see you next week. Next week's episode on Back to Basics.
Back to basics in the work that I do as a full-time employee in one of the largest maximum security prisons in the United States, and a passion after hours, is getting back to the basics. Means especially when it comes to working with offenders and ex-offenders, is the simplicity of good and evil. Back to the basics of choosing which path you're going to take in life. So when I hear of back to the basics, it's like, get back to the simplicity of it. Let's not complicate.